Hi, we're the clinical team of the Midwest Implant Institute. We're going to show you how to create a sterile field in your office. We feel this is what has worked best for us, and we're going to show you how we do it. Firstly, I'm going to get my cap and my mask. And some ordinary exam gloves. And the glasses. Then we're going to use a surface disinfectant that's been approved. We use Byrex. You're actually not supposed to use a aerosol anymore, because even though we have a mask on, because of the inhalation factor. So I'm going to move this over here, wipe down our countertop. As we know, our sterile field is from shoulders to waist. This is obviously below the waist. This is a dental office. It's not a medical surgery suite. So like I said, we're doing everything we can to create that field in the dental office. This setup that we're going to show you is for simple extraction, bone grafting, and implant procedures. Got an X-ray unit. Wipe down anything that we're potentially going to cover to use as a sterile field. We wipe down our chair. Put this back over here now. Mayo stand. Wipe down our light handles. And then we'll wipe down our surface over here. And the next thing I'm going to do, and I'm actually going to have to go out of the room to do this. We have a container here that has our anesthetic, our needles, and our barriers that if we try to sterilize those are going to melt. So we have some 190-degree water in another room. I'm going to run this underneath here. I'm going to bring this right back. Okay, this is our 190-degree water that we're going to run our barriers, our anesthetic, our needles. And it is very, very hot, so you want to make sure that you don't get that on your fingers because it will burn you. About 30 seconds, because if you do anything longer than that, it's going to melt. Make sure you get all your surfaces here. There we go. We can go back into our room and set things up. Put this right back on our little storage area here. So now I can touch any of that with a sterile glove because I ran it all under the water. I'm going to peel my exam gloves off and I'm going to get a new pair to start opening up all of our instruments. So, these are our surgical instruments. What we're going to do, we're going to get all this stuff off of our tray. And we're going to start opening things up. We all find our own little system to do this. This is what works best for me. This is our suction. I open this up can use this for my sterile field that I can open things up on. And we take our instruments, we'll open this up. We're only touching the outsides, we're not touching the inside, okay? Now in the state of Ohio, you must carry things in and out of a room on a tray. That's why we're not just using this cassette that things come in. Plus, we use more instruments than what that cassette holds, so it's impossible to use that. So I'm going to start opening things up. Got our suture. And we just throw things on the floor. We'll pick those up later. The drape. Our utility drapes. ARF box. Our handpiece. We have a curved and a straight blade. And all of your gloves to your surgical team. Plus an extra one that you're going to use to set up, which we're not going to open yet. Then we're going to come over here and we're going to open up our implant kit. Again, we're only touching the outside here. And open up our bite blocks. Burrs and we are lucky enough that we could keep our tubing in each room, so I could grab tubing here and open this up. Again, as you can notice, I am not touching any of this stuff. I'm opening it onto a sterile surface. Okay? So now we're going to get rid of these. And I'm going to pull on my sterile gloves. This outside, not sterile. Inside is sterile. Open those up. Grab the cuff. I'm going to slide my hand in, not touching my hand, not touching the outside of the glove. I'm completely on the inside of the glove. Over here, picking up the glove, not touching my hand, sliding it in. And I'm going to grab the bead, pull it up, grab the bead and pull it up, so anywhere that I touched is all on the inside, it's on the outside. So now we're going to get our instrument set up here, and again we have to take these out of this cassette. And the order is really whatever works in your office. We have a pretty specific order we put these in for a couple of reasons. Number one, the doctor has a couple of go-tos that he knows right where they are and he can just reach for them. Number two, if for some reason somebody gets called out of the room and somebody else has to come in, they know where things are. They don't have to wonder, oh, where's this, where's that. There are a few things that go over on the Mayo stand. We're going to put these here at the top. show you better. Alright. We kind of use these in the order, or place these in the order that we use them. So, mirrors, suction, local anesthetic. We use the Woodson 1, number 9. We have 2 of those and we reflect with those. And then a 14. Okay, so this is just works best for us. We have a couple of Seldons, a small one and a large one. There's also a large one that will go over around the Mayo stand and stuff to suture with. And our cotton plier, which is going to go over the Mayo stand, a curette, and a Greasy's curette. So I'm going to put this stuff that goes on the Mayo stand at the top because I'm going to move over there in just a moment. We have our high-speed handpiece, our burrs, light blocks, suction tubing, our gloves, our PRF box is going to go over here. That'll end up going on our Mayo stand. We have our curved and our straight blades. And then we have our other 2 drapes. So what I'm going to do now is I'm going to grab from our container over here everything that I ran through the hot water. We have all of our barriers here, and I can touch this because I ran this under the hot water as well. Just going to set that over there. Then I'm going to grab, this is a smaller case, so we're just going to grab like 4 1% lidocaine and some articaine and a couple of needles. And obviously if we need more, we have access to that all during the procedure. We can run those through. Attach our needles. Years ago we would soak this in either chlorhexidine or Cidex or something like that. They found that the rubber stoppers would get impermeated with the material, and that's not really a good thing when you're injecting it to somebody's body. Load those guys up. Now we'll put our suction on. And walk to the other side and attach it to the suction. Like so. We want our instruments to be our most sterile thing, so that's why we do this portion first, okay? So we've got that all set. We put doctor's gloves down. And we put one of our drapes over top. Then we put our 1033 drape that we cover the patient with, and then the first assistant in put their gloves over here. Now we're going to go over to our Mayo stand. I'm going to show you why I kept those like that in here in just a second. We're going to cover our Mayo stand. And then over here, we're going to grab our extra instruments that we put up at the top here that go for our assistant over on this side that handles all of the implant drills, the PRP, PRF, and whatnot. These are 2 little clamps to help secure the drape. And our PRF box. We're actually going to keep our implant kit over on the stable counter. Any of you that have worked with Mayo stands know that they can be a little unstable at times. So we want to make sure that that stays in good shape. We take our handpiece, put that in place. Now, you may or may not have a sterile person or a non-sterile person to help you. So I'm going to show you a couple of tricks here that if you are having to set up alone, that you could utilize so that you're not waiting till the last minute to set stuff up after you get your patient in the chair and you're all sterile again. So this is not sterile over here, okay? So I'm just gonna let this sit right here like this, and I'm gonna come back to it after I get all my sterile stuff done, because I have to hook that pump into the unit of the implant motor. Oh my goodness, I forgot to put sterile water in the pan over there. This is why I kept this. If you do not have that non-sterile person, inside of here is sterile. To rip this in half, come over here, get your sterile water bottle. And you can go ahead and put your sterile water in your pan here. Now we are lucky enough that we have sterile water coming through our hand pieces, so we don't need to use external irrigation when we use the high speed. Okay? So before I do this, there's one more thing I need to do. Put our barriers on. So our light handle covers obviously will not go on yet until we get our patient in the chair and draped. So I'm going to grab these guys. And sometimes this could be a challenge by yourself too, especially when they're still all wet like this. So sometimes, here's what you got to do. You have to put this one on first. As you can see, I'm struggling because I have gloves on and this is wet, but that's just part of the deal. Plastic is plastic. But you get it. You just have to stay with it. There we go. And notice, I'm not touching this at any time. Loop it over and pull it through like that. So what I'm going to do now is I'm actually going to take this glove off. So I can feed this in here. And when you've been a dental assistant as long as I have, you learn to do a lot of things with one hand. Like that. Now I'm going to take this other glove off and deal with this motor. As I said, this is not sterile. So what we've got to do is we've got to take this off. Take this off. Now I've just laid this right on the corner here so I can touch this, okay? Put this in like so. You want to make sure that this is closed down, if that's the type of instrumentation you use. Some people have the motors that have the sterile tubing that go along with it. These are disposable. We try to use as many disposable things as we can, like so. Now I can't run this through right now because I can't touch any of this. So once we get our patient all draped and sterile, that's when we'll have to run that through. So now we'll get our patient in the chair. So we've got our patient in the chair. We've reviewed medical history. This patient is not going to be sedated. If you're going to do your sedation, that would be done already, and at this point we'd be giving local anesthesia and drawing blood. So I'm going to put on exam gloves, and we're going to clean her mouth and face off with chlorhexidine solution. You can also use betadine, but we've switched to the chlorhexidine for a couple of reasons. Number one, the betadine tastes horrible. Number two, leaves her face kind of orange. Number three, a lot of people are allergic to it these days. So we've gone pretty much to the chlorhexidine 100%. So I'm going to get my exam gloves on and we're going to get her all set to have some surgery. Back here. It doesn't have to be sopping wet. You don't need to give them much bath. So we're going to grab 2 of these. We're going to do the inside of the mouth. Okay, Kenzie, open big for me. You're going to do the inside of the cheeks, the teeth, same on the bottom here, all the way around. Stick your tongue out for me. Now, I've had people ask me, why don't you have them rinse with it? Well, you can, but doing this right before we start surgery is going to have our optimal sterileness in the mouth, cutting down on the bacteria. And we're wiping everywhere that's going to be exposed, and you'll see that when we put the drape on. Okay? So now we're going to get rid of these. Go ahead and turn our light on. Get rid of our chlorhexidine. Now, I am not of average height. I'm short. I have to do it from this side. I'm not tall enough to be able to put the drape on from the other side. Pull my gloves on the same way. And we're actually going to save this and cover our mouse with it. That way doctor can manipulate any x-ray images. We're going to peel our cover off, toss that on the floor. Again, because of my height, there's a specific way I have to do this. This is the adhesive side here. Normally we tell people to visualize the 3M logo, which is right here. I can't do that, I'm too short, so I have to roll it down. You can see that 3M logo right there. That tells you that's where your sticky part is. So I put my hand on her shoulder, peel this across, okay? Then you do have to be very, very careful so you don't stick this on their eyebrows. And talk to your patient, even if they are sedated the entire time. Tell them what you're doing. Now, some people don't realize that this bothers them until it does. So Kenzie's like, okay, I'm claustrophobic. You've got to fix this. Here's what we do. We tell them to close their eyes. Keep your eyes closed. And we make a little slit up through here. Is it optimal? No, it is not optimal. But you can't have your patient uncomfortable under there because they feel like you're going to suffocate them. So we just let them peek out. And some people are so extreme that they can't even handle this. We fold it down and their entire head is exposed. Again, it's not optimal, but sometimes that's what you have to do. Then we've got our extra drape. We're just going to attach this here at the bottom to extend our sterile field. And I'm going to cross out to the other side. If you're noticing with my hands, they're right in front of me. They're not above my head, they're not below my waist. That's sterile field. Behind you isn't sterile, above you isn't sterile, below the waist is not sterile. So if you're not using anything, they're in front of you. So we've got our hose here, which I do not have the suction turned on. Obviously that would make a horrible noise and you won't be able to hear me, but normally we would have this on. And we use a Kelly curved hemostat. We grab a little bit of the drape here and a little bit of her bib, and that stabilizes the suction. And what you always want to tell them is, sorry, we have to lay a suction across you. You're going to feel some pressure on your chest. That way they know what we're doing. Even if they're sedated, you do that. So then we grab our little clips here. This is very slippery, so it will tend to slide, especially if you're doing an upper implant and you have them tipped way back. This keeps everybody happy, including the patient. Okay, now we're ready for our doctor and our second assistant to come in. Second assistant will come in first. They'll get their gloves on. We're ready to put our light handle covers on. We would normally have the light down lower, but it's in front of the video if we do that. So I'm going to do that, not touching the handle. Like so, and I'm going to put the light back up. And then our doctor comes in, and we help our doctor with the gloves. We do right hand first, extend that out, thumb toward the doctor, fingers underneath, right like that. Same thing with the other side. We do it the same way every time. We don't even have to think about it, we just naturally do it. Now we're all set to do surgery.